Hi everyone, today our video is about some of repeated questions, short questions in a nursing research and statistics. So first question is questionnaire method. So this questionnaire is a research instrument that consists of set of questions for the purpose of gathering information. So it can be from the surveys or a statistical studies. Okay, so this questionnaire can be have the close-ended questions and open-ended questions. So you need to explain about the close-ended questions and open-ended questions also. Okay, and next to second question is checklist. So checklist is the list of items that need to be completed throughout the research process. Okay, here you need to mention the advantages and disadvantages of checklist also. And next third question is item analysis. So item analysis is a process that evaluates the test questions by analyzing how students respond to them. Okay, and next fourth one, application of statistics in nursing profession. So here we application of statistics in nursing will be for the analyzing data and improve the patient care and design clinical studies. So for this all the purpose we need to have a statistics in a nursing profession, and here is some examples of statistics in nursing profession. As first one is prioritizing patient care. Okay, based on the patient need we are going to provide the patient care. Okay, so based on the priority we need to have a patient care. Okay, next designing clinical studies. So we need to design the clinical studies, right? So for designing the clinical studies we need to have a statistics in nursing. And next evaluating research data, and next making informed decision, and to avoid the analytic errors and to practice based on evidence. Okay, next central tendency. What is central tendency? So central tendency is a central value for a probability distribution. So here measure of central tendency are often called averages, and most common central tendency measures are mean, median and mode. Okay, so in this diagram you can observe the measures of central tendency. So those are mean, mode and median. Mean is nothing but the adding up of all the values in a data set and divided by the total number of values. And mode is most common value. So in this data set which is most common value, that is repeated value, is called mode. And median is nothing but the middle value of the given data set. Okay, next question is normal probability curve. So normal probability curve is a symmetrical about the ordinate of the central point of the curve. Okay, so here there is a difference between the normal curve and probability curve. So normal curve is a specifically refers to a bell-shaped curve that represents a normal distribution. So in this the curve will be in a bell shape, and probability curve is any curve that visually presenting the probability distribution of a random values, which could be any shape depending on the distribution. So normal curve which is in a bell shape, and the probability curve which is not having shape, that is it can be in any shape, it is depending on the distribution of a probability. Okay, and next seventh question, review of literature. Review of literature is a summary and analyzing of a existing research on a specific topic. So this can be include the definition, purpose and the steps of research review of literature also. And next, eighth one, processing data. It is a process of converting raw data into the usual information. So whatever information we have gathered from the sample, so that information we are going to concise and we are going to change into the useful information. Okay, it involves collecting, organizing and analyzing data. So steps of processing data includes the collection of data, preparation of data, input, processing, output and storage. You need to explain this all the steps of processing data also. And next one, ninth question, guidelines for a tabulation. So tabulation, what is tabulation? So tabulation is a process of organizing data into tables or a list to make it easier to analyze. So it is nothing but organizing the data into a tables. Okay, and here they asked about guidelines for a tabulation. So here we have some guidelines for a tabulation. So those are, first one is make it clear. So first we need to make the data clear, and second one, use clear titles. Third one, use appropriate size according to the content. And fourth one, use line to define categories. So lines are nothing but thick lines and thin lines. Thick lines to be separate the different data and thin lines to be separate subdivisional data. Okay, and next, use headings. And sixth one is use units of measurements. And seventh one is avoid consolidating large data. So that is, we need to avoid the large data sets, and here it can be best to split the data what we have. Okay, and eighth one is use cross tabulation. So this cross tabulation can help you to compare the results across the multiple variables. And ninth one is provide source. So at the end of the tabulation, we need to give a source of your data at the bottom of the table. So regarding all the tabulation, we need to have information at the bottom of the tabulation. Okay, so these are the guidelines for the tabulation. And next, 10th question is 10th one, reliability. So this reliability is a key part of assessing the validity of an instrument. And next one is characteristics and classification of hypothesis. So in this question, first you need to mention what is hypothesis, and then you have to write characteristics and classification of hypothesis. So here is the definition of hypothesis is, it is a tentative explanation that can be tested to see if it's true or not. Okay, and characteristics includes the clarity, testability, feasibility and specificity. So these are the four characteristics of a hypothesis. So those are clarity, testability, feasibility and specificity. And next, classification of hypothesis includes the simple hypothesis, complex hypothesis, directional hypothesis, non-directional hypothesis, null hypothesis and alternative hypothesis. So these are 6 classifications of hypothesis: simple hypothesis, complex hypothesis, directional hypothesis, non-directional hypothesis, null hypothesis and alternative hypothesis. Next question is advantages and disadvantages of questionnaire. So first question, we have discussed what is questionnaire, and here in this question they have asked about the advantages and disadvantages of questionnaire. So advantages are nothing but this questionnaire is a cost effective and fast results and comprehensive data also. And disadvantages includes the low response rate, inflexibility and response could be light, and accessibility issues and neglected emotions. So these are the disadvantages of questionnaire. And next question is steps in review of literature. So steps in review of literature includes, the first step is define your research question. And second step is define the scope. That means set of the boundaries of your review, including the types and depth of your review of literature. Okay, third step is search for relevant literature. Fourth one is read and take notes. And fifth one is evaluate the sources. Sixth one is organize your notes. Seventh one is write your review. And eighth one is edit and revise the review of literature. So these are the 8 steps of review of literature. And next 14th question is explain the guidelines for writing research report. So research report is an important thing which we can document the research process. Okay, so guidelines for a research report is defining a clear research question and conducting a thorough literature review, structuring the report with the sections like an abstract, introduction, methodology, result, discussions and conclusions, and presenting data accurately and citing sources appropriately. So in this you need to mention the structure of research report also. So structure of research report, which includes the title page, abstract, introduction, methodology, results, discussion and conclusion. Okay, and next 15th question is line and scatter diagram. So line and scatter diagram refers to a visual presentation of data where individual data points are shown as a dots on a graph. Okay, and line is drawn through the points to show the overall trend or relationship between the variables. So in this line and scatter diagram, the variable will be shown as a dots on the graph. So that graphs can be lined by a relationship between the variables. Okay, so these are the important questions in a nursing research and the statistics. Thank you.